So here you are, participants, all of our speakers lined up here in front of us, in front of you. This is the most unscripted part of the day. We're going to see how this goes, but we want to make it as useful for all of us as possible. And so first, I thought each of you have been here today and heard the other speakers, that you may have either questions of one another, those of you here in the chairs, or have comments that build on what another speaker said that resonated for you. So we'll just have a bit of a conversation with between speakers first, if any of you wish to say something, and pass the mic back and forth. And after however long that goes, we won't let it go too long. We'll move to Q&A. And because, again, of the recording and what's happening with the microphones, I will probably try to repeat questions that are coming from those of you in the room here so that we can, each of us here can hear it, but also that our colleagues who will be watching the video in a few weeks can also hear what the questions are. But are there anyone, give me a signal here if one of you has a comment or a question that you want to ask one of your colleagues, or any underlying of what someone else said that you want to repeat.
Thank you. I just wanted to say that we are so fortunate back in the UK of having 55 children's hospices in such a small space. But even though there's years of history back in the UK, I have learned so much today from all of you, and there are so many things, particularly the bubbles, that I want to take back and share with the UK. So please be assured that the things that you've shared today will reach far and wide.
Did you hear that compliment to you as well as to people in the room? Other questions or comments you have for anyone sitting here? Jacob?
Just from the standpoint as a music therapist and hearing, your work in the UK, I was curious, in palliative settings, what, and maybe at the facility you work with, but what maybe some of the complementary therapies or other similar programs might be in use, and how they might be similar and how they might be different based on what we talked about today. I don't know if you have things like music therapy and what that looks like, and how it might differ.
Yeah, great. So yes, we do. We have all the other therapies around music therapy, play specialists, and at Alexander Divine, we've just recently joined our physiotherapy and our music therapy together to do a moving and music session. But I was saying to Ted in the break, part of the challenge for me is making sure that the therapies are seen in balance and as equal importance to the nursing care that we provide. And that's sometimes a challenge. But yeah, it's really a good thing to hear your talk.
Sorry. Okay. Yeah, I'll just say something. We're talking about the UK. So I want you all to know, I grew up in Europe, and in Luxembourg. So every time we took Lauren there, I would get so angry. And I just want you all to hear this. Living in the United States, people in Luxembourg, this is a sweeping generalization, but are very... I don't exactly know the word to say, but they would treat Lauren not in a very human manner. And so they would stare and many times treat her actually like a monster. And I was irate whenever I would bring Lauren into public in Luxembourg. And I would say to my husband, we can never move here, because I would have to somehow change the entire way of thinking of an entire population, and it's impossible. And there are many European countries that do it well, the UK for sure, and Germany, really great. But we live in the United States where there is a different heart, generally speaking, towards people with special needs. And I am so grateful that Lauren was able to live and have great care here in Minnesota in the United States from all of these people. And we would never see something like this in Luxembourg, where people are coming to learn about how to better love, understand, care for this unique population.
Okay, let's turn it to you for a Q&A, and I will try to repeat questions. If you will go back to nursery school, if you're going to ask a question, and use your big voice. Remember that from nursery school? And maybe even stand so that you project, and I'll ask a question. If you have a question specifically to any one of the panelists, use their name, or if it's just the panel in general, let me know that. So who has a question or a comment? Let's get this going so that we hear some of your issues. Yes?
I do for Helen. So I'm curious, the name Alexander Divine.
The name of Alexander Divine. Yes.
And tell me about that person.
Yes, so in the UK, there's a number of children's hospices that have been built and set up in the memory of children that have died. So Alexander Divine was a young boy who died of a brain tumour, and it was his parents that drove the development of the charity in Berkshire. The first children's hospice of its kind was Helen House, and that was named after Helen. So there's a real mixture of names of charities that have either been set up in memory of children that died.
It's a variety of names from acorns to Martin House, which is named after the Martin bird, I think, to children's names. So, yes. Next question for the panel. Yes, Katie.
About the advanced care directives and thinking of our team and our role as
Have you say it for the...
considering our role as a children's hospice and respite home, and knowing that the children and the families have many providers, so this might be even for you, Lori, and Jeff and Christy to answer. What do you see as our role in building on that conversation and the timing of it when we know another team is also involved, maybe the children's hospice team, the palliative care teams at the children's hospitals? Is it redundant if it's asked again at Crescent Cove? All the ways, and I know Maddie spoke about this, and Erica and Jake too, how are we making memories and moments count and things like that? But when do you recommend, and how do you recommend from a parent and provider perspective?
Okay. Are you hearing the question of there are many people who may be involved in advanced care plans, and does Crescent Cove or Alexander Divine, maybe we start with you, Helen, do they take the lead, or do we begin to ask families or others having this conversation as well?
Thank you. That's a really good question. I think what we've tried to do in the UK is to try and establish ways of working together as a team. There's parents here, but I think in my experience, parents said that actually they would rather be asked than not asked at all. And so therefore, if somebody starts the conversation, actually it's a responsibility of all of us as professionals then to continue that conversation. But then it's about sharing so that we're not having to ask families to repeat something that they've said. So in the UK, we've tried to set up within each region an advanced care planning coordinator, so that they would be the person that would champion, promote advanced care planning, but then also have some oversight on maybe where those conversations have taken place with families. And that's how also that person is the person who, once the advanced care plan has been written, is the person that's responsible working with the families to make sure they've gone out to all the different settings and professionals. And if it gets reviewed, which is often happens, that latest version is also the one that's implemented.
Do either of you as parents have a comment about when you may have various conversations that are going on about advanced care planning? Is there a group, or should the parents take the lead? I'm thinking even of my own situation with, I asked my GP a number of years ago, do you work with older guys, with older bodies? I'm getting older, I want to be sure. Are you ready for gerontology? And she's assured me that she was willing to work with me, and so I began to talk about advanced care planning, and she said, I'm going to stop you. Have you talked with your family yet about this? If you have not, please talk with them first, and then come back and I'll talk with you. It was wonderful that she was saying there may be different people involved in the advanced care planning. Who's having that conversation? Do you have comments, any of you?
I'm not ready for that.
But I think about it a lot. I never used to. That's my coping mechanism, is to avoid it. And I think what's been most helpful for me in advanced care planning is Crescent Cove put together this group of families that had similar situations, and they added us to that group, and we were able to meet once a month and meet with a family group therapist. And I didn't grow up in an environment that therapy was really a part of our vocabulary. It wasn't. Emotion was harbored inside. So I'm learning through that group. It's been many years, but as Lori shared, those are lifelong friendships that we've grown to love and care for them and their children and siblings, and it's teaching me to accept the advanced care planning that needs to happen. And we're getting closer and closer to be able to talk and have them conversations. But I just thank Crescent Cove. I want to take a moment and just thank you, Katie, and Crescent Cove for putting that in our lives, because I know I have a lot to learn. I have a long ways to go, but I know it's important, and it's a process.
I'm just going to comment too, is a couple of weeks ago we actually met with Ted, and we were talking about what this would look like today. And just even within a family or a couple, how Jeff and I process information is completely different. And so for me, it's something I have thought about since Caden was born, honestly, where Jeff, it's been much harder to have conversations. Neither are right or wrong. We just process information differently. And so I think, Katie, your question about is it redundant, or who's responsible, I think different people are at different places. And so for me, the more conversations, it's better. Because sometimes you don't always think about it from a certain angle. And so having numerous conversations, sometimes about the same thing, brings up different information.
I'm also remembering, Maddie, what you were sharing, that sometimes it's not a direct conversation about advanced care planning, but it's about memory making. Let's get some photos about what we're doing today. Let's remember this event and so on. So it's not focused on end of life, but it began to introduce kind of memory making along the way so that we can have those conversations. And part of what I think Jeff is saying, and you as well, Lori, is sometimes it needs to happen at a peer level, both within families, with other families. I know some of the families that were involved in that couple support group and so on. But for those of us who are volunteers or professionals, we may need to have these conversations at a peer level as we work at Crescent Cove or other pediatric palliative care centers, rather than always just with the parents. But how are we dealing with this as a team? How much do we even give people permission to talk about these things? Do we even raise the possibility? Not to impose it, but to invite it. Wonderful question. Let's get some more questions. Yes?
Does Crescent Cove ask for like an advanced care plan when they take clients in?
Katie, you may want to speak to that one. Or does Crescent Cove, is there, when families enroll, does Crescent Cove invite them to consider an advanced care plan? Is that part? Okay. 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 Who wants to speak to that? Catherine? Okay, let me be sure if I'm repeating correctly. She's saying that at Crescent Cove, we don't initiate it, but encourage the family to have the conversation with their family physicians, their general practitioners, but that you are then supportive and want to be in that dialogue with whoever's doing the primary medical work. Am I understanding correctly? We'd want to know the contents of the package and the plans and the things that people are talking about so that that can inform the work that's going on at Crescent Cove. There's the teamwork again. Yeah, thank you. Wonderful question. Who's next? Q&A. Over here, yes.
My question is complex, but then I also have my mother who lives with us. And so it was very surprising at our first primary meeting, because my mother's English is still, it's good, but she did hand me the directive care plan and said, you know, do you have one? You should get one in place. And so have there been studies or discussions about how we bring directive care plans to be like everyday language? Because as a parent, you start worrying about your wills, and I had to set up the trust because of supplemental need trust. And they start asking you about, what do you have as a care plan because one of you might pass? What happens if both of you pass? So I think it's that whole planning discussion, and has that been put into place that just, it's like a will or a trust. It's something that you get in place when you have a family.
And who's the question for?
Helen, or anybody who can speak to that.
Okay. Okay. Were you able to hear the question, Helen? In terms of
I think so. Thinking how to answer you. I think the experience that I had through the study that I undertook and parents were describing, that it was about a process, and actually there are some parents who described that the conversation was more important than actually having the written plan. So back in the UK, we would say that actually as long as we could record some of the conversations that we've had, that's equally important. And so I don't think we would probably go down the line of saying, well, you have to have a written plan, because I think sometimes that puts families off because they don't want to see it written in writing. And I think some of the experiences that parents shared through the study was that, yes, when they'd done it and they had the written plan, it was really supportive. But I think, like Jeff has described, you know, it was a process to get to that point, and they wouldn't have wanted it imposed on them before they were ready. So I think if we put in place, oh, you've got to have a plan, then we take away that choice and that space and that time for people to, parents to journey to get to that point. Does that answer your question?
I think related to this, there was a haunting article in the Star Tribune recently written by an EMT, an emergency medical provider, a firefighter, and my son's a firefighter as well, so I know this, and he was urging people to have these kinds of conversations and to move it to a written plan, because if an EMT comes to your household because someone has collapsed and needs immediate care and may even be in life jeopardy, the EMTs have no, the only thing they can do is to do everything they can do to keep the person alive. They must. It's legally bound and so on, unless there's a written directive, a post or an advanced care directive that gives them the freedom to then back off and honor what the family's decided, that spoken words are not enough. So we need to begin the spoken conversations and begin to aid people in opening up about this with one another, so it may then lead to, if there needs to be some kind of written directive. Yes. Yes, Rhonda.
I can project.
Oh, please. And I will repeat, just for the audience. Let's just do it that way. It's better for everybody.
So I hear you saying, Ted, spoken words are not enough, and I just want to clarify, if a parent is standing next to their child, or an adult child is standing next to their parent, is it legally, I wonder.
I'm not certain. I'm not privy to all of the legality.
Does anyone know, is my question.
No, it's not legal.
I think it's not legal because they know that parents can be divided. This may be an impulsive choice, and so that's the reason to have the conversations. Do I even dare say it? Early and often as we are ready for it. And I understand Jeff's comment and others of not wanting to move too quickly on this, but the more that we can begin to just open the door and give people permission for the conversations, the better, because it may need to be in written form to be legal, depending on who's there at the moment. Yes, next questions, comments. Let's take advantage of the panel as well as one another. You have one, Logan?
Hi, this question is for everybody. Just wondering what projects or goals or milestones you all are working towards, or like next steps for your future, if you have any.
So both for the professionals and the family? and the families. So we just go down the row. Tell us a little bit of what's next. What are you passionate about for your next projects? It's a wonderful question.
Well, Catherine's just making me do things all the time, so there's a lot of bugs in my ears to keep speaking about things and keep being a voice for Crescent Cove and for our patients. So I see more of that probably in my future. But when it comes to just Crescent Cove as a place, I think now that I'm well established there, I've been pulled into more of like policies and procedures and things like that. So it's been really cool to help like with the building process of Crescent Cove, not just showing up and doing my shift, but being part of the brain work behind what we do. So it's cool.
What's your next project, Jacob?
Well, with regard to Crescent Cove and the work I do there, I've over the last couple of years have started to have practicum students and things like that just to help with music therapy in this population, because there's not a lot of opportunity to do that. Well, as you know, around the country, but in Minnesota for sure. And so we have started to move forward to try to Alliance Music Therapy in partnership with Crescent Cove, trying to organize an internship program to help kind of increase that exposure for students to get experience working with this population, because I think it's really important. Yeah.
What's next for you or Alexander Devine?
Yes, I guess back in the UK, although there's a lot of us in terms of hospices, we're trying to find much better ways of working in partnership with one another. We can't all do it just on our own. And so we're trying to establish some what we call managed clinical networks, so networking across a wider footprint, geographical footprint, so that hospices are actually working together. And that way families are not falling through the gap, and that hopefully everybody should be able to access children's palliative care.
I can think of lots of things, but probably putting one foot in front of the other, keep living forward, and taking, like I said earlier, the lessons Lauren's taught me, and currently really investing in my high school students. I think a lot of this is very foreign to them, so I'm really trying to advocate for those who don't have a voice in our high school where I teach. And I don't have to advocate for Lauren anymore, but I certainly can keep advocating for people who can't do that as well for themselves.
I guess in terms of Crescent Cove, as I'm like phasing out from being a nursing assistant there, I'm being pursued to volunteer. So hopefully that the next couple of years. I am starting an OT position next week actually. And my hope is to continue working with kids that are in palliative care, just because I will be working at a clinic that provides intensive therapy for medically complex kids, and so there's a lot of crossover. But yeah.
When you asked that question, the very first thing that popped in my mind was pure survival. When you have a medically complex child, that really is at the forefront. And so that's my first answer. My second answer is that when opportunity is provided, that we continue to advocate.
I mirror that. Advocating it, I think even today has helped me realize how important it is to bring the awareness to other parents and medical professionals that are dealing with medically complex and special needs children. And I think that's what I'm gonna explore a little more and try to refrain my silence to see what's out there and how I can maybe get involved.
The comment I would add in terms of, especially lots of us in the room, is, and Erica and I had this conversation that she wears three hats, as a nurse as well as a musician, and she's also, in this case, a sibling. And so we were talking about how do professionals and volunteers manage their own well-being, manage their own care, and how do they bring their better selves to a child, to the team, to the family, than their depleted selves. And so part of what I think is important, that we be alert to our own care so that our others in our circle get the best of us, not our depleted selves. So I would say that for those of us in families as well as those of us doing work as volunteers and professionals. Got time for just a couple more, and then we're going to move you to think about some takeaways from the day before we end the day, and some final words from Katie. Yes? I thought you were just waving at me.
Thank you so much. Thank you all for sharing such beautiful stories with us today. This question is really for the families, Catherine, Lori, and Jeff. I'd like to kind of just from your perspective understand you've had, your journeys with your children. Where in that journey did you feel most supported? And then where were the gaps, really, in terms of resources from a clinical standpoint, emotional, social support? Where do you felt like it's a missing resource in our community? What is it that we need to work towards to helping you support your journey with your children?
Let's see if I'm summarizing as I walk back to ask all of our parents, what are examples of some of the best care that you got along the journey? Wherever you were, and then what were some gaps that may still be you're quite aware of gaps in your things you wanted from people that you did not get, especially professional providers?
I think for me, for the biggest support was Crescent Cove, as mentioned, had sponsored a support group, and that support group has been going on 5 years, 6 years, 7, I'm not even sure. But that has honestly been one of the biggest supports of my life as far as helping me through some of these struggles, is being a part of parents that understand what we are going through and can support each other and learning from one another. I think the gaps, I think of 2 things, is just the medical field in general. I think appointments are oftentimes on such a timeline, and finding people who can really take the time to listen is super, super important. And then on break, I'd also just talked with a parent, and this has been heavy on my heart, is sibling support. It's not just the parents, it's not just the medically fragile child, but it's literally the family as a whole. And I think for younger children, there's younger siblings, there's not a lot of support out there. So that's something that is really needed.
I can just butt in for a moment and speak to this last issue. And it happens that I was at Alexander Devine last year and was sharing that at Crescent Cove, there had recently been a sibling retreat, an overnight just for the siblings. So no child in care, but these were the siblings. And the whole staff said, "Oh, you did what?" And they turned to Helen and to the founder of Alexander Devine and said, "Can we do that here? Can we do that here?" And it was that Crescent Cove had taken a big giant step toward trying to have sibling care. And the purpose of the retreat was first to just talk about their lives. And only in the last portion of the retreat weekend did they talk about being the sibling of a child, so on. So I'm just reaffirming what you're saying in terms of sibling care. Do you want to add anything to what?
Well, the only thing that is coming to mind right now is the communities. I think it's not just an awareness from medical professionals and siblings, and I'm kind of afraid of this thing. Sorry. But I think of a little story about when we bring Caden to the YMCA and he does some swimming or something, and I was sharing this on the break, and families or kids mostly kids, they'll stare, and they're curious. They stare out of curiosity, not out of anything ill intent or anything, but it's sometimes the parents' reactions to that. They will pull their child away like he's infectious or something, and it's heartbreaking as a parent to see that happen. And I just think the more that we involve these children in the communities and bring them out there and expose them to things like the YMCA or wherever, it's important. I think that's a gap right now.
Do you want to speak to gaps as well as signs of service?
So before we moved to Minnesota, we lived in Wisconsin. And I think I have the comparison between the two now. Minnesota is just phenomenal with special needs supports in so many different levels, just incredible. And I'm really thankful we live here. So I would say 15 years ago when Lauren was born, I think there's been a shift since then in care, but it was very much what the medical professional thought that's what would happen, not so much what did I think was a good idea as a parent. I've seen a huge shift in that. So that used to be a gap that I would say is not. I've gone to so many appointments at Gillette specifically. I cannot say enough good about Gillette. They are, I don't even know if anybody's here from Gillette, but oh my, okay, thank you. It was kind of, if this would be great for Lauren, go for it. If not, don't do it. You know what's best. And I'm thinking, oh, they're listening to me. And just all of the supports there. Pediatric home service, amazing, amazing. And all of these things matter to families with special needs kids because we have so many things we're thinking about. Another thing where I have felt so supported is with groups like Hope Kids or A Kid Again, groups like that where the whole family is included, and Crescent Cove, obviously. There's events for the entire family, for the siblings, and they don't end when the sibling has passed away. That's huge. We can continue having networking with families like that. I would say one gap for me probably has always been where I'm speaking with a medical professional or a therapist or somebody's in my home, and I say, what kind of resources are out here for this? And they go, I don't know. And that's not their fault. I just wonder, how can there be better communication between things that are out there with the medical professional specifically, where families with special needs go constantly, and they can be a channel for that. But I would say, I think there's other places to get that information too. I think as a special needs family, we had to resource so much with other special needs parents, and we would say, so tell me, what are you guys doing? Tell me about your life. And that's how we get ideas, but that, that's not always enough. So I would say that's the biggest gap that I see.
I realize that I should clarify my comment about sibling care at Alexander Devine. Your staff was doing it. They just had not done an overnight retreat. That was the part that grabbed their attention. Yes, so sibling care was going on at Alexander Devine. I just want to be clear about that. And Josh came, and he was hoping by the end of the day someone would salute Gillette. So thank you very much. Yes, Jenny. It's a question about Wisconsin Dells, and for the video audience, this is a family retreat center, a fun place in Wisconsin, and evidently you had differential reactions when Caden and you went over, and so she wants to hear some of that story.
Yeah. Okay. It's a story that, so we went to Wisconsin Dells, and, that's popular around here. We go out there, water slides, and of course, Caden, we've already shared that he loves the water. And we're excited. And we went in and at our place, and we all got in our suits, and we went down, and we're ready to hit the slides. And I'm bringing Caden up this ladder, and we got all the way to the top, and the lifeguard wouldn't let us go down. She said he has to go on his own. He has to be able to stand and go in there. I said, well, he's not going to. He's in a wheelchair, so I'm going to put him in it, and my other son is at the bottom, and he's going to catch him. Nope, that's not our policy. He wouldn't let us go. And I was just sitting there dumbfounded. I couldn't imagine that they have 15 handicap parking spots outside the Dells, but yet they have a 5-foot slide down there with maniac children going up and down and attacking and crawling over each other. So I didn't press it too hard. We eventually did get him to go down the slide, and he had a great time. But that story does sit hard with me. It's where people, they're told a policy, and this was a young kid. They're told something, and that's what they do, and they follow it, and they don't know any better. There's no listening to the parent, listening to that going on. So thank you, Jenny.
As a parent or anybody here, later my son is different. He's big, he's not mobile. So we want to take him to places, but we never can do it. He cannot go on a plane. It's so big for him. We just cannot do anything. He like to swing, he like to go to like Magic Mountain. We just cannot do it. So it's so any resource that we can do it, that is so much limited for him and for my family.
Okay. Any advice for there are barriers or are there things that it appears that a child cannot do that can go to the two of you or to Lauren, because both of you, I'm sure, have experienced that. Do you want to speak to it? What can a parent do when you even are a bit skittish yourself because of the child's ability, or there may be rules, as was said, with this other?
That's so hard. I'm so sorry, Stacy. Lauren was small. She was barely 80 pounds when she passed away, but I still found it. There were times where we said, we can't do this with Lauren. It's impossible. And for me to say it's impossible felt so defeating and sad, and our family really enjoys being active. So I think the main thing I would say to you, and this is a lot of work, and maybe you have extra help with your son. What's his name? Dylan, with Dylan. It helped so much for us to have PCAs who would help with Lauren and help us feel like we had a life, but so much of our life was divide and conquer. And so I think even though we had extra help and we had Crescent Cove, Crescent Cove's the only reason I'm still standing here on my 2 feet, where we could, with our other children, say, we're gonna go on a vacation and we're gonna leave Lauren at Crescent Cove. And we went, and it was so life-giving for our family. So be willing to leave your child with other people who will take great care of him, but also realize it's hard then. You are dividing and conquering together as a family. You're not together because of the extra needs your son has. And so many times too, I would have to tell myself, I can choose to be so mad and annoyed and upset about this, or I can choose to make the most of it. That was me. So I think what I'm saying is have a lot of people around you, as many people around you as you can, to help and support and be there with you.
Well, conscious of time, and as I said earlier, we want to be sure that you do some take-homes, and Katie's going to have a few words. But can I ask you to first, can we thank these people for sharing their stories? Thanks to you to one another. Wonderful. Look at this, a standing ovation. I don't know that we introduced Helen's son, Chris, who's is right here, standing up for his mother. Did you see that? Welcome to you as well. They came over to be with us today. He's close to being a doctor. He has the training, or what is internship or residency is coming next, so good wishes to you. But we want you to think about what has impact, what's a take-home for you. So would you take either an individual 3 or 4 or 5 minutes just to think about what's a take-home for you today. Talk with neighbors at your table. We'll give you just 5 or 6 minutes. And then we want some final words from Katie before we send you out into traffic and the rest of the day. So think a little bit about some take-homes for a few minutes. Thanks to you again. You may want to think about take-homes as well. You may go from here.